Welcome to the Holistic Plastic Surgery Show, where we dive deep into the hottest trends in health, beauty, and cosmetic treatments. I'm Dr. Anthony Youn, America's holistic plastic surgeon. Approximately 1 in every 2.5 million babies are born with craniopagus. This is what occurs when conjoined twins are attached by the head. Jadon and Anias, two 13-month-old brothers, were born with this condition, and without surgically separating them, their lives would be incomprehensibly difficult. So Jadon and Anias' parents moved from their home in Indiana to the Bronx, where they met my next guest, a board-certified plastic surgeon who specializes in craniofacial reconstruction. And after a grueling 27-hour operation, Jadon and Anias, who previously had been attached by the head, were separated for the first time. It is an amazing story of survival, hope, and the power of modern medicine to perform miracles. So let's get started. My guest this week is a world-renowned board-certified plastic surgeon specializing in cosmetic and reconstructive surgery of the face, breast, and body. He is the director of aesthetic surgery at the Montefiore Health System and an assistant professor of plastic surgery at the Albert Einstein College of Medicine. My guest is the director of the craniofacial surgery program at Montefiore due to his extensive expertise in craniofacial surgery. He has authored over 50 textbook chapters and journal articles and is frequently asked to speak at national and international meetings. His pioneering work on 3D imaging in plastic surgery and stem cell therapy to reverse age-related damage has earned him a number of awards from plastic surgery organizations. I'd like to welcome my guest, board-certified plastic surgeon, Dr. Oren Tepper, to the Holistic Plastic Surgery Show. Well, thank you so much for coming on the show.
Thank you, Tony. Pleasure to be here.
Okay, well, before we get started in talking about the conjoined twins, specifically Jadon and Anias, let's start by talking about your practice. And now you're in New York City, correct?
Mm-hmm.
And what type of practice do you have? Where do you work?
So I'm at Montefiore Medical Center, which is in the Bronx, and I have a pretty unique practice, but I think it's a lot of why people love going into plastic surgery, certainly why I did it, which is it's really diverse, and I do a little bit of everything. I am a board-certified plastic surgeon. I do a lot of reconstructive work, and I do a lot of cosmetic surgery. So when I completed my plastic surgery training, I went on and did what's called a craniofacial fellowship. It was an extra year specializing in reconstruction of the face, of the bones, the skull, etc. And what it's afforded me was the opportunity to take part in really, I think, interesting and unique reconstructive cases. And so, look, I do a little bit of everything, but it's why I think many of us chose plastic surgery as a specialty, because we have the ability to do so many different things and impact so many different types of people.
Yeah, and I tell you, I do mainly all cosmetic surgery, and I get a lot of patients that will tell me, oh, I so admire the work that you do, and this and that. It must be so difficult. You have to have all this training. And honestly, when I look at the surgeons that I admire, it's doctors like yourself. I mean, where you're really at the forefront of so many of these advanced procedures, things that I couldn't even imagine myself being able to do. So you're the type of doctor that I look up to. And so when patients ask me, well, they say, hey, Dr. Youn, this cosmetic stuff you're doing is so great. It's like, that's just the tip of the iceberg. The really cool stuff, I think, is what you're doing. So let's talk about how you got into separating conjoined twins. I mean, this is definitely the some of the most advanced surgeries that we're doing in the entire world.
Yeah, I mean, this is certainly nothing I ever imagined I would be involved with. I never saw it. I never read about it. It's not in the plastic surgery textbooks. But look, and I appreciate your comments, what you said about reconstructive surgery and what I do, but I think for the listeners, it's important to know, people like you, people who are board certified in plastic surgery, all did some type of training in reconstructive surgery. And I think, and you would probably agree that it makes us better cosmetic surgeons and vice versa. So we have a perspective that's really unique, I think. I certainly took part in a lot of reconstructive cases. Conjoined twins are so rare that I never thought I would see them, let alone be involved in a case like this. It happens that I joined a very well-established craniofacial program, and there's a neurosurgeon who is really the world expert on this, named Jim Goodrich. Now, world expert sounds somewhat misleading because he's been involved with at most 10 cases around the entire world over a 30-year career. So we're talking exceedingly rare. But he's at my medical center. We work together. We do lots of cases together. And the family, the McDonalds, who were involved in this case, were resourceful. They read up. They knew he was the guy to go to. They came to New York to meet us. And I was the plastic surgeon involved with our team. So,
and so if you're listening to the audio podcast, on the video podcast, we do have a picture of these amazing two boys, Jaden and Anias. They're just a 1-year-old, right?
Yeah, and by the way, close to my own son's age. So, and my only son, my only child. So it was interesting for me, and I think difficult in many ways, that here are two boys similar to my own son's age, developing the same way my own kid is, and then having to embark on a surgery like this. And emotionally, and I think just professionally, that was one of the more difficult things I had to deal with.
How many conjoined twins have you actually operated on? You mentioned that Dr. Goodrich is the world expert with conjoined twins with craniopagus, which is where the twins are actually attached by the head. When you're not including craniopagus, which I know watching the CNN documentary, it's 1 in every 2.5 million births. How many just general conjoined twins have you operated on?
0, and I haven't seen them, and I think you'd be hard-pressed to find surgeons and physicians who have taken care of. But let me clarify, 1.25 million is births, right?
Yeah.
Then you have to think about the subset of those that survive, that make it to a point where they can be separated, and anatomically are even possible that we can do this. So we're talking 1 in many, many millions to ultimately get to a point where you can surgically operate on them. And look, to be candid, that's one of the most anxiety-provoking parts about taking part in a case like this. But what I had to do is we stick to the basics. We stick to what we know. We really go back to the founding principles of plastic surgery, things you and I do on a daily basis, and just apply it to a case like this.
So in their case, Jaden and Anias, they're about 1 year old. They were joined by the head. Now you used some 3D imaging. You also, worked with the radiologist. How big was this team that was necessary to separate these twin boys?
So surgically, we were 50 people in the OR. And for those of you who have been in the OR, either as a surgeon or a patient, that's a lot of people for a relatively small space. But they were all critical. And yes, so just to give you some kind of general guidelines, who was involved. You have anesthesia teams. Now, remember, they're attached, but they're 2 different patients. And they physiologically respond very differently. So you have to treat them as such. So imagine you have 2 complete OR setups for 1 room. Radiology is not typically in the operating room, but in a case like this where anatomy and understanding 3D analysis was so important, they played an incredibly valuable role in this. And then we had a lot of engineers, particularly bioengineers, who are not surgeons, they're not medically trained, but they understood exactly that. They understood the 3D models and the 3D anatomy, that it became a very unique collaboration, I think, that made it ultimately possible.
So if you can take us through, the patients, Jaden and Anias, are in the preoperative room. Obviously, the parents, kiss them and say goodbye. You bring them into the OR. They're put both under anesthesia. They're on separate breathing machines, obviously.
Yeah.
How does the surgery start? My understanding, watching the video, is that you began the surgery, and then shortly thereafter, Dr. Goodrich came in. Can you give us kind of a play-by-play, a blow-by-blow of how the surgery went and how you actually do this operation? You don't have to get into too much gory detail, but how do you separate these conjoined twins? And then how do you do the reconstruction, which was a big part of, obviously, you being there too?
And this is an interesting question because a lot of people have asked, why is a plastic surgeon involved in a case like this, where it's 2 presumably boys who are attached at the brain and they forget all the other reconstructive needs. So the way we approached this was through stages. And the reason we do that is because it is such a big surgery for any one of those boys to handle in one operation that it can be life-threatening. And they share not just brain, but they share blood vessels. And so the idea behind staging it is going through each operation and dividing some of the vasculature, some of the blood vessels they share, coming back after a few months, and then dividing the rest. So if you think of a cylinder, it was essentially into 4 different parts. So we did 4 surgeries. So about 75% of the way divided, and then that final stage was that last quarter, that last 25%. The reason we're involved is simply just dividing the brain and leaving it exposed, again, can be life-threatening. So as the reconstructive surgeon, what we need to do is we need to cover that. We need to cover it with a protective layer over the brain, we have to cover it with bone, and we have to cover it with scalp. And one of the ways that we were able to do that is to insert what's called tissue expanders or balloons that you would put under the scalp, slowly balloon that up so that you would gain or recruit more scalp, and then use that for the closure.
Did you actually put expanders into their scalps then before the surgery, and you were expanding?
Exactly. So between the 3rd and the 4th stage of the surgery, I put in tissue expanders. And over those 3 months, we slowly introduced water into that balloon. Now, these boys, they went through a lot. They persevered. I can tell you what the family sees are those expanders, the needles that are used to inflate those. And so that was almost in some ways the most traumatic part of the whole experience for the family, because it wasn't a simple surgery. That was months and months of slowly increasing the size of those balloons or those expanders.
So Dr. Tepper is explaining here what the idea of a tissue expander is, for those of you who haven't heard of that, is you've got 2 boys here that are attached by the head, and there's not enough scalp there if you were to just separate them to cover basically the 2 heads. And so what he did was he ended up putting basically what are inflatable balloons underneath the skin to gradually get that skin, that scalp, to stretch out so that when you did separate them, you had enough excess scalp that you can cover both of them. Now, their hair pattern is probably going to be, as a cosmetic surgeon, I'm thinking, but their hair pattern when they become adults is probably going to be what yours or mine is. But obviously the main goal is to get the brain covered and to get the scalp and everything closed. So.
And it's funny you mention that, because the parents, as they should, were concerned about the cosmetics, and they had a very good perspective on all this. But particularly Mom, they had these cute little hair tufts that she said, "Can you preserve those?" And the way you make the incisions, and we got them separated, and they do have hair, and they have a couple of areas that are missing hair. And Mom asked me about that, and I said, if 10 years from now the discussion we're having is their hair pattern, then we have done exactly what we set out to do. And I would love nothing more than for my conversation with the family 10 years from now is how do we make their hair pattern look a bit better.
So this operation took all of 27 hours. It's the longest surgery that I myself have ever heard of. I think the longest that I've ever been involved in an operation, maybe about 14 hours back in residency. How did you do this 27 hours? Did you, at times, were you able to step away, or Dr. Goodrich able to step away for a couple of hours just to get some rest? How did this work?
I don't know if a couple hours, certainly a couple minutes. There was so much adrenaline, it felt like a few hours, not many. But, I talked about CNN being there and all the things that added sort of anxiety and pressure. One of the things that helped having CNN there was that as an organization, their employees need a place to rest and food and refreshments, and we had a whole setup for the team of CNN. And as you know, the OR doesn't usually have that kind of stuff. So for those 27 hours, it was actually one of the more comfortable days in the OR, 2 days, because we had a whole setup of things to drink and eat and take a break if needed.
So you were there the entire 27 hours then? You and Dr. Goodrich? Wow.
Yeah, we were.
Wow. And how much of that time do you think you were actually scrubbed in, standing there, helping and performing that surgery?
Yeah, I would say 20 hours for each of us, probably. Wow. So we were there a long time.
So doing these types of surgeries, obviously, this was your first one. This is such a extremely rare situation. You've done a ton of craniofacial reconstruction, but not necessarily the conjoined twins. What are some of the things that you thought of going into the operation, and what were some of your fears? And especially during that surgery, I know that there were some times during the operation that were quite tense and quite concerning. What are some of those things that you feared, and what are some of the things that did happen during the surgery that were challenging for you guys?
Well, a couple things. We knew there was going to be some unexpected moments. So expect the unexpected, and most surgeons know that. We planned everything. We brought in technology that very few places in the world are using, and we really, I think, minimized as much of the unknown as we could possibly even come up with. But having said that, we knew there were going to be some unexpected moments. I would say there were two things. The first is I, at some point, was concerned that we were not going to be able to separate these children. And that was a very difficult decision. We had many people around the world watching us. Most importantly, we had their parents and the family outside who were just wondering, was it going to be possible or not? And to think scientifically and medically and not emotionally at that moment, to say it can or can't be done, was very difficult, because if it really came to a moment where it wasn't possible, I think emotionally that would have been a very difficult thing. So we had to really stay within the, can we do it medically? Can we do it safely? Mm-hmm. And we did, ultimately. Mm-hmm. The other thing to mention is, yes, there were some very scary moments, and they weren't surgical. They were more physiologic in terms of anesthesia. And what happened is they had shared so much physiology that one could sort of carry the other one in need. And when we finally divided the boys, they had to go fly on their own. And there were some moments, particularly with Anias, that he really had a tough time controlling his blood pressure, and things got very unstable. And that's a very scary moment, because as a surgeon, we deal with emergencies, but we deal with emergencies usually that we can handle surgically. Mm-hmm. And this is one of those moments where I had to rely on everybody else, the anesthesiologist in particular, to say we need these boys to be stable. And there's nothing I can do. There's no maneuver surgically. There's nothing technical that I can come up with to get them out of the situation. And that's a very humbling moment, just to rely on those people around you, because I'm at the mercy of them being able to do that. And I credit those people really for doing that.
So prior to undertaking the surgery, you got a lot of imaging studies done with the radiologists. My understanding with conjoined twins is sometimes they share certain organs, and the problem with separating them is that there's one organ and there's two people. With a brain, that's the same case. Now, did both of these boys have fully formed brains, where you're not necessarily having to remove a portion of the brain for them to survive, or is this a situation where there are certain parts of the brain that may actually be missing in one boy, yet the other boy may have that now?
No, and it was that, exactly, Tony. So about 75% of their brains were completely independent, normal. 25% they shared. And of that, there's a portion of functional brain, which controls speech and motor activity, etc. And then the other are some of those vessels I mentioned. We call them sinuses, that drain the blood from the brain. And they shared those. And we had to devise ways to essentially give one of the boys that anatomy while sparing the other one, knowing they're not going to have that, and to see if they'd be okay. And so that's where it really got intricate.
So the boys get separated, and your chief resident, they ask, okay, who wants to make the last cut to actually separate the boys? And your chief resident, Dr. Carrie Stern, who I've met before, actually on the phone, I think, and on email, she was the one that was the lucky one to separate it. You do the separation, and that's when your work really also kicks in, because now you've got the separation. Did you do both of the reconstructions, basically closing the defect yourself, or did you have one side done by one surgeon and you did the other one?
No, I had to orchestrate. I had to rely on a lot of surgeons. There were a lot of other attendings, plastic surgeons who were involved, Dr. Garfine, Dr. Lawrence Draper, Dr. Conejero, all colleagues of mine and partners who came in for the very reason you said. I'm one person, and I really needed to kind of be the person who was overseeing all of that. The resident issue with Dr. Stern was sort of interesting, because she had very little to do with the case. There was one little piece of tissue that was still remaining, and we said, who wants it? She quickly grabbed the scissors after probably sitting. She probably was there for all 27 hours. She cut it. And the next day there was an article about what it's like to separate twins, with her featured by her. And so a learning lesson for me, maybe not to give up the final cut so quickly. But she deserved the credit. But yeah, absolutely, there were a lot of people there, and this was not a one-person show at all. There were lots of doctors involved.
And now this shows it's a small world. Dr. Garfine, that's Dr. Jennifer Ashton's brother.
Yeah, exactly.
Yeah, I know Jennifer Ashton very well, and I know she said her brother's a plastic surgeon, so I didn't know that he was involved with that. That's great.
Yeah, Evan Garfine's our chief. He's a tremendous guy, and he really he's one example. There were so many people behind the scenes who deserve credit, and yes, CNN featured myself and Dr. Goodrich, and that's just natural. The surgeons involved, but there are so many people who really contributed to this.
Yeah. So then you separate the boys. You've got enough soft tissue. So going into kind of the reconstructive standpoint, you have expanded the soft tissue, meaning the skin and the fat and the underlying galea, which is kind of some of the covering over the bone. Did you have enough bone though to cover the brain, or is that something that you're going to have to do more reconstruction with later? Because that's the one thing that we can't expand is bone. You can't use an expander to expand that.
It's a great question. So this is a lot. I'll tell you where the technology helped, which is it would have been a bit of guesswork. It would have been all guesswork for me to know, do I have enough bone and do I have enough scalp? And I know I say that with some trepidation to your listeners because they would think that medicine today is all, we know the exact science of it to the millimeter, and we don't for the most part. But one of the areas we have made a lot of progress in is the idea of simulating surgeries on the computer first. And that's where this became so helpful. So what I was able to do is I first separated the boys on a computer. And I did it with a company called 3D Systems based out of Colorado. And what that told me was, okay, if I separate them as such, how much bone do I need and how much scalp do I need? And then you can start putting real metrics, real numbers behind that. How much tissue expansion do I need? I was able to determine what areas of bone they share that were thick enough so I could split it and now use half of it for Anias and half of it for Jaden. So it was sort of amazing. It worked out that they would have enough bone, exactly enough bone to cover both.
Really?
Yeah. And the interesting with the expanders, right? So industry has been involved in 3D design for quite some time. So the companies that provide the expanders have those 3D files. And so we took those expanders, the 3D virtual versions of those, and we virtually expanded the boys also. So I separated them, I reconstructed them, and it was all done on the computer first. It was really pretty fascinating. And I knew at that point I'd have enough scalp. If I didn't have that at my disposal, it would have been, I think, but it would have been sort of game time. And I was able to minimize a lot of that.
So you didn't have to do any type of special flaps, like free flaps, meaning moving body part from one area to there. I mean, that saved you multiple hours then of a potential more surgery with these kids.
Right, and you know, like all of us, Tony, there's always plan A, plan B, C, and you run down the list. And I wanted to make sure that we were sticking with plan A and just reserve those in case we needed them. And we didn't have to do that, and I think that technology really helped us.
That's great. So how are you using 3D? I mean, this was a huge part of, treating Jaden and Anias as efficiently as you have. How are you using 3D now with other cases in your practice?
So for the last 10 years or so, I use 3D imaging for complex reconstructive surgery for cases like this, where I'm trying to minimize the unknown, recreate something that's specific to that patient. I do it with skull reconstruction. I do it with reconstruction of the jaw. It's really almost become standard practice for what we do from a reconstructive world. And then more recently, and I know you've spoken about this in other forms, 3D imaging or 3D printing is making its way into cosmetic surgery. It's a bit new. For the most part, it's been more for education and consultation. But I think we're not far away from those very same applications making its way into aesthetic surgery, where we have models instead of just pictures to help us through surgery.
So most of the 3D that you have done, the 3D imaging, has been pretty much on a 2D screen, but using kind of 3D imaging to see how things work. You haven't necessarily used a 3D printer to help with these surgeries that much yet.
Well, I have in reconstructive. In the cosmetic world, and I know you do lots of this. So if, for example, you're doing a rhinoplasty, which is changing somebody's nose, what most surgeons do is they'll have a 2D picture and they'll take it to the OR. What I can do using this technology is take not a 2D picture, but a 3D model. So I have a 3D model of where they started, where I'm hoping to get to, and I actually use it in the operating room as a guide. It's a reference. It's a tool. It's certainly been helpful to me.
So then for these boys, did you use the 3D printer as well to help kind of for you to design these flaps, or was that something that wasn't as necessary with this case?
No, we had dozens of prints. That was very helpful, yeah, because imagine you have a patient come to the office, you can twist, you can turn, you can look at them, you can make measurements. With these boys, just turning them, it took a whole army, right?
Yeah.
So my wife didn't love it, but I have the 3D print of these children at my bedside for months that I was looking at, making measurements and planning out the incisions.
Oh, that's great. And then were you able to get then a 3D printout of, or a 3D, like, the printout, the creation of their brains actually fused, and so you could see where the blood vessels are, and okay, we're going to dissect this direction and all that?
It was exactly that. So we had the prints of the boys, we had the prints of their skull, we had the prints of their brain, and a step further. So we had where they shared the brain, and then we developed a model so it was color-coded exactly where they shared brain. So we knew the areas that were safe planes and the areas where we had to be a bit more careful. So the technology has come a long way, and it was incredibly helpful in a case like this.
Yeah, that is absolutely incredible that you guys were able to do that, and especially where this technology is going. Where do you think is kind of the next frontier with this type of 3D technology and the 3D printers?
So, a couple things. I think the 3D printing has value, and certainly in surgery where it's tactile, we need a physical model. I think the next big frontier, though, is going to be taking that same image and creating a hologram. So rather than having the physical model available to us, we have it in a hands-free way, and we can pull it into the operating room or pull it into a consultation when needed. The software is not there just yet, but we're close. And so I think the natural transition is going to be models plus virtual models or virtual reality, essentially. And so those two emerging.
It's going to look like that person's standing right in front of you or sitting right in front of you.
Absolutely. And imagine, like you said, the brain, imagine we had a hologram of that brain rather than a physical model available to us.
And then you can just say, turn it with your finger and all that type of stuff. That would be fascinating. Yeah. It's funny, you mentioned hologram. I was we were at Vegas Cosmetic Surgery together.
Yeah.
And was it Vegas or was it at ASAPS that we were talking?
No. Well, both. I think Vegas. We had the panel together.
Yeah, and my wife and I went to see the Michael Jackson Cirque show there, and they have the hologram of Michael Jackson there. Incredible. I mean, you could not tell that this was not actually Michael singing and dancing there. So, I mean, there is that technology, and I think, you use it for one thing, you think, with entertainment, and here you go, you can actually use it to help save lives as well.
But our worlds need to talk. So the last time I was in Vegas, when I saw you before, I saw that same show, and I had the exact reaction. It is, for all intents and purposes, Michael Jackson is performing on stage, and we need some of that in medicine. And there's a lot of smart people working on that, but I think it's around the corner.
Well, that's great. I mean, I really want to commend you on taking on such a challenging case. Do you have any other cases that are interesting like this coming up around the bend? Obviously not giving away HIPAA or any patient privacy that you are working on? Yeah,
nothing to this extent. But look, we do so many interesting cases. It's the beauty of plastic surgery. So I'm excited about it, and for my career and yours, and I think we're doing some amazing stuff.
So the boys, the surgery was a success. I know the boys have had some challenges, in their recovery. They had some illnesses, and how are they doing now? I mean, it's been, how many months has it been now, approximately?
So October 13th, they were separated. So, we're getting close, 6 months plus since their initial separation. They have done really well. I just left the hospital a few hours ago. I saw Mom was there with the two boys coming for a visit. I hadn't seen them in the last 4 weeks or so. They're starting to talk. They're starting to walk. They're sitting up. I have every reason to believe they're going to live fairly normal lives, and it's incredible to watch.
That's great. Well, I ask all of my guests, I ask a question at the end of every show, and if there's one take-home point or piece of advice that you'd like to give our listeners and our viewers today, what would Dr. Oren Tepper, board-certified plastic surgeon, what would you say that would be?
Well, for me, so I guess it's more a word to those who are in careers or in jobs that require this kind of dedication where you can't easily separate. And something a lot of people talk about today is work-life balance. And I think it's an important thing. I certainly, I have a family. I want to spend as much time with them as possible, and I do think it's an important thing. The problem is people talk about work-life balance as if there's a divide between work and life. And I guess my advice and what's worked well for me is it's not, that division is not so clear. I love what I do, and I do what I love. And that is a part of my life. And it's not simply turn off, turn on. And I think it's helped on both fronts. I would encourage your listeners, those who have pursued careers they love, it doesn't have to be two different worlds. They can merge, and I think it's been rewarding for me on both ends.
Well, thank you. Well, his name is Dr. Oren Tepper. He's a board-certified plastic surgeon in New York. His website is Oren Tepper, MD, OrenTepper.com. You can find him on social media at Dr. Oren Tepper. Thank you so much for coming on the show. This was absolutely fascinating to hear about your experiences with separating these twins.
Thanks for having me.
All right, well, I'm Dr. Anthony Youn, America's Holistic Plastic Surgeon. We will see you next week on the Holistic Plastic Surgery Show. Do you want to look 10 years younger without having surgery? Well, my best-selling book, The Age Fix, will tell you how. I spent the past 17 years learning the secrets to turning back the clock and have written all the best of these secrets in this book. This includes the Age Fix diet, simple changes to what you eat that can make a huge difference in your appearance. I'll share with you a simple skincare routine to keep aging and wrinkles at bay. And I'll share with you the best secrets to treat every single beauty and aging problem there is, from age spots to wrinkles, saggy skin to bad breath, saddlebags to hair loss. And almost all of these can be effectively treated without surgery. So are you ready to turn back the clock and kick Father Time's backside? If so, check out The Age Fix. Now, if you purchase it on my website, dryoun.com, you'll get over $10 off the cover price, free shipping, and you'll receive several free gifts, including a bonus chapter that you can only get by purchasing the book there. Thank you for making The Age Fix such a huge success.